For years, people have been hiding something. And that something is their double chin. 67% of aesthetically oriented consumers surveyed online are bothered by submental fullness. And 1 in 3 aesthetically oriented men say they identify with having a double chin. Interest doesn't just come from established patients. 38% of Kybella patients were new to cosmetic procedures. Excess fat below the chin is one of the top 5 aesthetic concerns among aesthetically oriented patients. You could help do something about it with Kybella. Allergan is going to help start that conversation. Look for our new national advertising campaign on TV, in magazines, digital, airports, and gyms. With over 250 million impressions, reaching millions of consumers, women and men. So get ready. Kybella is about to get people talking. Get a sneak peek at our new national TV commercial now.
You inherit lots of traits from your family. My ancestor, Lady Eleanor, made it big in textiles. My great-grandfather Bernard wrote existential poetry, and Uncle John was an explorer. I inherited their can-do spirit and their double chin. Now I'm going to do something about it.
Kybella is the first of its kind injectable treatment that destroys fat under the chin, leaving an improved profile. Kybella is an FDA-approved non-surgical treatment for adults with a moderate amount of fullness, or a bit more. Don't receive Kybella if you have an infection in the treatment area. Kybella can cause nerve injury in the jaw, resulting in an uneven smile or facial muscle weakness and trouble swallowing. Tell your doctor about all medical conditions, including if you have had or plan to have surgery or cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near your neck, or have bleeding problems. Tell your doctor about all medicines you take. The most common side effects are swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. Find a doctor at mykybella.com.
Kybella, detailed important safety information. Kybella deoxycholic acid injection is indicated for improvement in the appearance of moderate to severe convexity or fullness associated with submental fat in adults. The safe and effective use of Kybella for the treatment of subcutaneous fat outside the submental region has not been established and is not recommended. Important safety information. Kybella is contraindicated in the presence of infection at the injection sites. Cases of marginal mandibular nerve injury manifested as an asymmetric smile or facial muscle weakness were reported in 4% of subjects in the clinical trials. All cases resolved spontaneously, range 1 to 298 days, median 44 days. Kybella should not be injected into or in close proximity to the marginal mandibular branch of the facial nerve. Dysphagia occurred in 2% of subjects in the clinical trials in the setting of administration site reactions, for example, pain, swelling, and induration of the submental area. All cases of dysphagia resolved spontaneously. Range 1 to 81 days, median 3 days. Avoid use of Kybella in patients with current or prior history of dysphagia, as treatment may exacerbate the condition. In clinical trials, 72% of subjects treated with Kybella experienced hematoma, bruising. Kybella should be used with caution in patients with bleeding abnormalities or who are currently being treated with antiplatelet or anticoagulant therapy, as excessive bleeding or bruising in the treatment area may occur. To avoid the potential of tissue damage, Kybella should not be injected into or in close proximity 1 to 1.5 centimeters to salivary glands, lymph nodes, and muscles. The most commonly reported adverse reactions in the pivotal clinical trials were injection site edema, swelling, hematoma, bruising, pain, numbness, erythema, and induration.